Hey guys, this is Stephanie here with Empower Physical Therapy. And today we have Dr. Randall. And I am so excited. I'm actually going to be sitting back listening to this because I've heard amazing things about, just being able to treat the mouth, specifically TMJ type stuff, more holistically and why traditional treatments don't really work. And so we have Hillary, one of our physical therapists here, that's going to be interviewing him. And I cannot wait to listen and learn more. So take it away.
All right. So excited that you're here with us, Dr. Randall. So tell us a little bit about yourself and your practice and how you've got into the specialty of TMJ and really are quite an expert after talking to you. So how did you get into that?
Well, it's just been an evolution for me as a dentist, right? So going to dental school, wanted to be the best dentist I could be. My dad was a dentist. He was dentist for 46 years, practiced in Louisville, North Dallas. And he did basic bread and butter dentistry and had a good relationship with his patients. And he enjoyed talking to people as much or more than he did doing the dentistry. He just liked being with people. And so that was kind of the primary thing that I saw that I wanted to be a dentist. And so I went to Baylor Dental School, which is now Texas A&M Dental School here in Dallas. And from there, I went to Richmond, Virginia for a year and did a 1-year residency, an advanced education in general dentistry, where I got to meet some private practice dentists in Virginia who kind of steered me to want to do more in the TMJ, full mouth rehabilitation and ideal dentistry and things of that nature. So that steered me to a postgraduate training facility in Key Biscayne, Florida, called the Pankey Institute, which was at that point in time, that and the Dawson Center in Florida were basically the two premier training facilities for postgraduate dental training for TMJ and bite correction and full mouth rehabilitation type stuff. And so did that training and the airway and TMJ stuff weren't connected at that point in time. And so as we learned to do the TMJ treatment taught by those folks back then, there were some challenges, there were some difficulties, there were some questions that couldn't be answered. And so I just kind of kept searching, kept looking into things, and finally did some training here in the Metroplex with my mentor, Dr. Hal Stewart, who had taken his level of TMJ and occlusion, which is how the teeth fit together, and the joints and the muscles. And that training he took to, in my opinion, to the highest level, which is biorejuvenation dentistry, which restores teeth without, if possible, grinding them down for crowns and veneers and taking away the, what we consider priceless real estate, which is the enamel. You only get one round of enamel. So if we can keep it and preserve it, then we consider that a real benefit to anybody. But even in his training and his practice, there were still some things that were causing issues. And he discovered that airway problems that people had were the primary cause for people to get TMJ issues, and therefore cause failure of his restorations and failure of the beautiful porcelain crowns and beautiful composite resin aesthetic stuff that he would do. And not all of it, but when trouble would happen, he would, he discovered that, man, I did everything the way I always do it. I don't know why this is failing. And so his eyes were opened when he came across this airway treatment that said, hey, we got to look at the airway before we look at anything else. And so the TMJ, the cause for all the TMJ stuff, kind of crystallized and said, hey, the stress that people are applying to the joints, a significant amount of that stress is being applied at night when they're sleeping, not because of life stress, although there is that, but primarily because they're not breathing as well as they would normally need to breathe, because the airway is too small, the tongue's taking up too much space. Well, what was causing that? So we started realizing that the jaw joint was paying the price for the upper jaw or lower jaw or being too small, closing off the airway. So that just opened my eyes to, oh my gosh, I can't not see this now.
Right.
So I see it so often now in patients. And so I just have gone on a journey to figure this out. And
It's so interesting and so cool, because it really is. It's like, if you look at the things that we need to do as human beings, like number one thing is we need to breathe. So we're going to do everything in our power to figure out how to breathe most efficiently. So and looking at the jaw, if we're not able to get the air in because the airway's too small, our tongue's too big, somewhere down the road, things didn't form how they were meant to, we are going to stick our chin up like this to get more air in, to open the airway. So then we get issues in the jaw, and then also into the neck as well. And it's so related. So it's just fascinating.
Sure is. Yeah. I've been just amazed at, really, I feel like we were all created to have 32 teeth with jaws big enough to have all 32, and have a tongue space big enough to not close off the airway. And, we've learned that over the last few hundred years, humans' jaws are getting smaller. And maybe it's coming from the Industrial Revolution. Maybe it's coming from how we're not breastfeeding long at all anymore.
Yeah, like how is this happening?
Yeah. So the effort, necessary for breastfeeding, which, go back to Adam and Eve, Cain and Abel. I'm sure they breastfed for a long time because they didn't have bottles and things of that nature. So the force of having to breastfeed is truly a predominant cause for the development of the upper jaw and the face. So a lot of that's getting short-circuited.
Right. So tell us about who your typical client is and what they look like.
Yeah, so it could be anybody, right? Any demographic, any age, male, female, but I would say 90% of TMJ patients are females. And I don't know 100% why it's females. I've heard that there are estrogen receptors in the jaw joint that get more inflammation. But typically, I think the male bones and male structures are able to withstand maybe less than optimal structural sort of integrity. They can handle that a little more with more force, and maybe we beat up our teeth more than we do our joints. I see that primarily as an issue. A lot of times it's females who've had braces once at least, and maybe a second round of braces, and then maybe even Invisalign. That kind of a path is something we see on a recurring basis, where a lot of Invisalign patients are treated, or even orthodontic patients are treated, without really studying how do the teeth need to fit together when the joints are where they belong. So we fit the teeth together without paying. Skip that. And then significant amount of those people aren't being evaluated for airway, or they didn't previously in previous decades of orthodontic treatment. But there's certainly a little more awareness of the airway now with orthodontists. The X-rays that were most orthodontists are taking are 3D X-rays that can actually measure the volume of the airway. And so when that gets measured and it's really low and small, they're like, okay, this might be a red flag. I don't know if much of that's being treated, but anyway, typically females, in the mid 40s or 50s.
It's interesting you say that, because I'm thinking now, it's interesting you say that, because I'm thinking now back to some of the patients that have come in and had some jaw pain, and all of them are female. And I can't actually remember having a male patient who came to me with jaw pain. So that's funny. That's interesting.
Yeah. Go ahead.
No, so, and a lot of them too, like a lot of patients I find, they come in and we're really starting to treat their neck, because they come in, with neck pain, and they'll associate physical therapy with, they could treat my neck, right? But if you ask them questions about, do you have jaw pain? They're like, oh yeah, I do actually. I've had it for 10 years, and they don't really think, this is something that I can treat. Or they've been to their regular dentist and they have a mouth guard that might have helped at some point, but a lot of times they're like, yeah, I've had it for 3-4 years. Don't know if it's helping much anymore. They're grinding on that as well.
Mhm.
So can you touch on that a little bit, kind of about the aesthetic part, the mouth guards, and I know you have a specific way that you work and treat the jaw with the guard.
Sure.
So
Yeah, so a night guard is it's very common, very well known. Most people know about them. Most dentists provide them. But the TMJ therapy, TMJ problems it's a very mysterious sort of I don't know why it's mysterious, because they don't teach it very well in dental school. Maybe we don't have enough time to learn all the intricacies of it. And there's different philosophies, believe it or not, of how to treat TMJ. There's a neuromuscular approach. There's a centric relation approach. There's a bioaesthetic or biorejuvenation approach. And so there's just a lot of confusion around it. And to really learn it, like I feel like I've been exposed to some extremely good teachers of it. And you got to spend a lot of time, and it costs a lot of money to go do all that training. And so, most people most dentists just want to do their dental practice. And it takes a lot of time with that person to go through the conversation. It takes time to listen to all the problems and all their issues and help steer them towards the right solution. And so there's most busy practices don't have a whole lot of time for those long conversations and consultations, which is kind of where my practice is maybe a little different than most. I don't have a lot of chairs in my office, so I've got to be hopping from chair to chair. I've got 2 chairs, and I spend time with each person for as long as I need in order to, help take them to the next step. And so, with the night guards that most people come in, a lot of times they'll come in with 2 or 3 night guards saying, well, this one worked for a while, but then I had another dentist make this one. And so now I've got these, but I'm not really sure which one really is good.
a lot of confusion.
Yeah, a lot of confusion. And so if a night guard is made, well, it might keep the teeth from touching so the teeth don't grind each other. But if there's an airway problem where the jaws are too small and then the airway itself isn't improved at all by a night guard, and so they still clench and grind. And then typically the night guard is made, they fit it one day, one appointment, and they go, okay, you're good. But the joints and the teeth may not be really in harmony with that night guard. So I don't make night guards per se anymore. I make orthotics, which are something that requires a repeat appointment to adjust it to balance out the bite in the jaw joint, so that they're at least in harmony in that relationship. And then if there's an airway issue, then we go down that road.
Right. And you talked a little bit about how you can actually work to expand the palate to allow more room for the airway.
Yeah, that's right.
Expand the jaw. And I just found that very interesting because I'd never heard of that before. And I was thinking to myself, like, I probably need that. My jaw is probably too small, but talk a little bit about that, how you go through that process and why it's important.
And what's that?
And why it's important to look at.
Yeah, so the jaw, if it's not big enough, your tongue is going to be cramped inside in the tongue space. There's a great dentist named Felix Leal who wrote a book called 6 Foot Tiger, 3 Foot Cage, and it's a strange title, but the title says it all, really. And the concept is, if you try to stuff a tiger into a 6-foot tiger into a 3-foot cage, it's not going to want to do that. And you're going to probably pay a price by trying to stuff a tiger into a 3-foot cage. It's going to lash out. It's going to beat you up. It's going to scratch and claw. And the same concept, your tongue would be like the tiger, and the teeth, the top teeth and the bottom teeth would be like the cage. And a tongue that's having to live in this tiny space, it's going to cause problems. It's going to manifest itself differently for each individual. Some people are going to clench and grind. Some people are going to not clench and grind as much and wear their teeth out, but their joints are going to pay a price. And so, historically, there was a significant period of time when orthodontists were pulling teeth when somebody had crowded teeth to make it easier to straighten them. They'd pull 4 teeth and then they'd close up the spaces. Well, that really closed up the tongue box, the tongue space, right? And so those folks tend to be ones that really have a lot of TMJ issues, a lot of grinding and clenching, because their jaws weren't big enough for all the teeth. And so what they needed was jaw expansion, which is the device that you and I had talked about, where we fit somebody for an appliance that slowly, passively, painlessly stimulates growth of the maxilla. And it's a controlled growth. It's not an overnight process. It's meant to be a slow process, kind of like how bone would grow. And over time, once you get to the size of that jaw that we are trying to achieve, and then we monitor it with a sleep study that proves that somebody's breathing better and is getting plenty of air, then we know we're done with that treatment. And it's a permanent treatment, as opposed to getting a CPAP machine for sleep apnea, breathing better. Well, if you don't have the CPAP on, you're not going to breathe better. This treatment is permanent, and it's permanent airway improvement. So it's amazing.
I think it's so interesting, like some of the things that you say, because it's so similar in our practice, because we think these things are so simple, but like having a 5-minute conversation or 10-minute conversation with a client, you can't get a diagnosis that quickly, like at our office. Like there's no way. So like going in and saying like, oh, I have knee pain, or I have neck pain. And all of a sudden it's like, okay, let's do an image. Okay, this is what we need to do. I'm like, no, like you have no clue where it's coming from. And what are all the components that go with it? I mean, there's so many things that we have to look at to really get to the source of the problem. So we're not just treating symptoms, because we do in this country. We just treat symptoms.
That's right.
Oh, do this, treat this symptom, treat this symptom. It sort of works, and it doesn't work. And then we have people that are so frustrated because it's like nothing works. I'm just gonna have to live with this for the rest of my life. And it is so not true. It's just getting to like, you have to get to the source. And that's what we don't do. And you can't do that in a short conversation. You have to spend time like what you do, like what we do, in order to really figure out where, even if we have to figure out where we need to send them. Like there's times when pain for us like is autoimmune, and you can tell when it is, because they're not responding in a very mechanical pattern type way. And so we've got to send them to another doctor that we know that will take care of them. Or there's an emotional component, and we can tell with that. We've got to send them to another person that's going to take care of that piece of it. Because if you don't get to the source of it. So it's not any different here. And it's so interesting, like, everything that you've said, because it makes sense, with what you're saying. So it's so cool.
Yeah, it's really neat to be able to get to the root cause of things. Right? It's kind of, it's not in my way of thinking about dentistry. I want to do dentistry for people and have them not need any more dentistry, right? Be done, right? You don't need to be coming and getting something done and fixed every year. I'm not looking to utilize your $1,500 of dental insurance every year, right? You don't want that. I don't want that. Let's get you fixed in a way that you don't have to redo things. And so if you get to the root cause of what's causing a lot of the issues, man, you just change people's lives.
Mm-hmm.
So,
and that's fun. Like that's something you want to wake up and do every single day, because you can impact someone's life that no one else could. That was so frustrating. Like, and that, I mean, that's ultimately, that's why we exist.
Mm-hmm. That's awesome. Yeah, that's great.
So I guess that kind of leads into my next question for you. Why do clients love what you do and love coming to see you?
I think that it's because they haven't heard this sort of a discussion before. We have the conversation I had with you when you came in. It's the same conversation I have with patients who come in saying, hey, I've got some TMJ issues. And we just go down that road and like, nobody's ever talked to me like this before. I've never heard this. I've never had an explanation. It just, wow, that makes total sense. It seems like it's right. And so then we start down the path and we do the treatment, and they start to see benefits and results, and like, of course this works. Of course it's right. And so the goal is to be done and not to need anything other than just, your cleanings and maintenance stuff, right? So,
Exactly.
yeah.
How often do you hear your patients saying they also have some neck pain in relation to the jaw?
Oh yeah, it's almost always associated with
Right.
headaches, neck problems, shoulder tightness.
Yep.
You start to clench and grind because you don't have the proper airway. Well, that's going to recruit more muscles, right? You're going to try to, your body's just going to compensate here, and it's going to compensate here. And now all of a sudden you've got this whole system that's out of whack. Just nothing's in balance, and you can't find relief. And so, one thing leads to another, so absolutely.
Can you touch a little bit on kind of like why do we clench because we can't breathe? Is that something that is our body just kind of like, it's a response to be like, hey, or is it a check-in? Like, are you good? Or why are we clenching at night?
Yeah, I think it's a stressful response. Like when I went through all the training at the Pain Institute, and we told people it was either they're stressed and that's why they clench and grind, or their bites off, right? Like something just didn't register. That's what I was told by the professionals, right? The guys that taught everybody, the experts. And so that's what I would tell people. And they would look at me like, I don't think I'm stressed. I mean, I sleep pretty good, but once the airway component came into view for me, I couldn't unsee it. It's like, if you've gone to the ocean, and swimming in the waves, right? And you're body surfing or something, and a wave tumps you over and really pushes you down under the water, and you're like fighting to get up, but it's kind of pushing you down. You're not breathing. When you're not breathing, it doesn't take very long for you to kind of get a little panicked, right? I'm stressed. So I'm like, oh, wow, stress is the right answer. When somebody's at night, when they're sleeping and they're not breathing well, they're under stress if they don't have all the oxygen that they need. Your brain's got an oxygen monitor in it. Just like when you're going into surgery, they put an oxygen monitor on so they can tell how much oxygen is flowing, circulating in your blood all the time. And right now, as we speak, every second, we need all the oxygen that we need. And our brain is monitoring that. But when we're asleep and we're unconscious and we have something that can compromise the airway, with our posture, tongue dropping back, or jaws being too small, when the oxygen isn't there, then our body says, I got to have oxygen. Your brain needs it. It needs it right now, and it needs it always right now. And so it's a fight or flight response. Your body's the only thing that moves relative to the airway in your body is your lower jaw, right? Your nose can't flare and open up real big, and your airway back there is not going to open up. And so your body will clench and grind. It's a response to, I need oxygen and I need it now. If you take a CPR course, what do they show you to do with the mannequin on the floor? They tilt the head back and chin up to open the airway, right? And so that's like moving your jaw forward. So you physically will fight or flight response. I got to get some air. So you slide your jaw forward. Maybe it's a clench and powerful movement. So that's my understanding of
no, it's definitely makes sense for sure.
Yeah.
So how can people find you if they want to, use your services and that type of thing? Are you like through your website, or?
That's probably the best way. Yeah.
Okay.
Website, drdrewrandall@gmail.com. www.drewrandall.com is the website. Then email, drdrewrandall@gmail.com.
And then you said something about you did some sort of like consultation, just like we do here. We do like a discovery visit where you can come in and sit down for free and just chat to kind of see if the services are what are right for you.
Exactly. Yep. We just had one just now before this call. We had a consultation with a female, in her mid-30s, is given TMJ problems, and so we sat and talked, and for sure, the screening to me, first initial evaluation shows me there's an airway compromise, but so we'll see if she wants to move forward.
Excellent, great. Well, we'll definitely continue to, I love learning from you and stay in touch, because a lot of my patients that are coming in for neck pain also have a jaw issue. And I really feel like we can definitely help each other and treat each other and give our patients, what they need in that way. So
Absolutely. That's great. I appreciate having a, a thoughtful and like-minded
Yeah.
resource to work with. That's awesome.
Excellent. And thank you so much. Anything else you'd like to add, or how about you, Stephanie? Anything?
No, this is fantastic.
Yeah.
I mean, you just already for me, I'm a very logical person. If you can explain it to me in a logical way, it's like, oh, that totally makes sense. Like, and that's, I mean, everything you say, like, oh, that totally makes sense. I mean, even from you aren't breathing, and it's the stress, but not the way we think the stress is. It's the way the body is stressing because it's not getting the air that it needs. And we think it in a completely different way. So it is correct the way we used to think, it was created, but really it's from something else. But anytime we can have people that can kind of, get to the source of what it is and not treat a symptom, that's who we want to send to, because I just get so frustrated with our medical system, because there's no time that you're spent with patients. And they don't get to the source of anything. It's just like, throw this pill, let's do this surgery, let's do this procedure, but they're all symptomatic and not really getting to the source. And it's frustrating. It's frustrating for patients too. And there's not a lot of people out there like us.
Yeah.
At all.
I agree. I agree. There's very few, no question. Well, it's great to be in relationship with you guys and work with y'all.
Yeah. Well, awesome. Well, thank you so much. This is going to be awesome education for just for anyone that's looking to get true resolution in their mouth.
Absolutely. Well, thanks for having me. I appreciate it, and good talking to you guys.
You too.